Care is defined as the ability to convey what's important to you in a way, in a language that's important to the patient. You can convey what's important to you, the treatments, the angulations of the fillings, etc., 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 in a language and communication that's important to the patient. The patient will say, yes, absolutely, no problem, doc. I'll take that treatment off you, no problem, where do I sign? Biggest conflicts that we have with patients isn't that the patient doesn't want our treatment. Sometimes we say, oh, Mrs. Jones, here's a treatment plan. We'll see you next week. Mrs. Jones never turns up. And you think, oh my God, she can't afford it. And next week you see her driving down the high street in a Bentley or something, maybe. But it isn't that the patient cannot afford it. It's the fact that we haven't cared enough to ask the patient quality questions and find out the values of that patient and then communicate in a language that's important to us in a way that the patient says, yes, doc, I'll take that off you. When's my next appointment? Do I make sense? Is that making sense? Yes? Our ability to care is translated in our communication, that what's in our mind gets translated in our hearts, gets translated to other people. And our wealth in our practice is going to be determined by our ability to care. I know so many academic dentists, I know have high acumen in academia, absolutely brilliant and genius at knowing about the ins and outs of dentistry. But when it comes to treating patients, it comes to translating that care, they say, now I get stuck with that because I don't know how to care for the patient. All I know is this mental mindset, which is theory. You need both components. I've always said that the practitioner is present and whose mind is present and powerful, whose heart is full of love and gratitude, that's where consciousness healing happens. That is what's going to build your practices, where your mind is present and powerful and your heart is full of love and gratitude. You love what you do what you love. That's what's conveyed to the patient. They're not just paying us for our clinical abilities on how to do a prep or the angulation of the fillings or whatever it may be, or the root canal. They're paying us for our care, and we're a caring profession, and that's what's going to determine your wealth ultimately. In addition to the websites, in addition to the social media and all the marketing, you can do all that, but the care really happens in the surgery, and when the patient leaves, phone them up, see how they're doing. Mrs. Jones, are you okay after your extraction? I phone every single patient that I do treatment on, other than a scan and polish or a checkup, obviously, and say, Mrs. Jones, how are you doing? Are you okay? You saw us yesterday, day before. Are you okay? We just want to know if you're okay. Great. And you need to tell them as well before they leave the surgery, or they might get a bit suspicious. Why is this doctor phoning me up? But you need to tell them.